According to the CDC, nearly 1 in 3 Americans are obese. And if the trend continues, estimates can put that number at 43% by 2018. It's disheartening, but there are options and solutions. And that's why I'd like to welcome Dr. Tom Sonnenstein with Ohio Health, who is an expert in bariatric surgery. So thank you for being here, doctor.
Thank you.
Well, let's first talk kind of about your background, because you're very experienced in this specific field, right?
I am. Originally from Marion, Ohio, and did most of my medical training in surgery at Riverside, and I took over the bariatric surgery program in 2011. I've been doing bariatric surgery for just around 13 years now.
13 years, so highly experienced. For those who may not know, though, out there maybe, can you sum up what bariatric surgery is?
Bariatric surgery is commonly known as weight loss surgery, but it's really more than that. We actually consider it to be metabolic surgery. And the fact that we're treating not just a patient's weight, but also their medical problems such as diabetes, high blood pressure, heart disease, sleep apnea.
All those things can come along with being overweight or vice versa, right?
Exactly.
Okay, so who would be a candidate, somebody out there watching? I know it's not always just about a specific number, right?
Correct. We do our measurements based on BMI or body mass index, and there's cutoffs for that.
Okay.
Typically, that's about 80 to 100 pounds over an ideal body weight. And most of the patients, of course, also have a number of medical problems.
Okay, so things have come a long way when it comes to this surgery as well. And I think people may be surprised to learn just how kind of minimally invasive it can be today.
We've come a long way. We do our surgery minimally invasively, which means small incisions, typically 5 or 6 small incisions to do this great big operation.
Okay, so that might give people some idea that maybe nervous about it, that it is something that they can go through.
Absolutely. It doesn't take away the fact that it's a big operation.
Sure.
But certainly the small incisions decrease the amount of pain as well as decrease the amount of complications that patients typically have.
Let's talk about how you do things at Riverside, because it is not just a specific surgery. You say goodbye to the patient, have a good day, you're on your way. You treat the entire patient, which you mentioned. How do you do that?
We really establish a relationship with the patient, and we treat the patient and not the disease. We have a team of number of medical doctors, nurses, dietitians, psychologists, our surgeons, a team that takes care of the patient from beginning to end. And you're correct, we don't just see the patient, do surgery, and then they're off on their way. We expect to establish a lifelong relationship with the patients.
I was going to say, it begins even before you would get to the point of doing a surgery, right?
Absolutely. They spend at least 4 months with us before any operation is done.
Okay, and then after the operation, I would hope, and I would think your goal, right, is to get them to a lifetime of being at this ideal weight and healthy mind, body, soul kind of thing, right?
Correct. They'll see the surgeon at least 5 times the first year after surgery. Plus, we want them to stay involved with the dietitians, the psychologists. We have monthly, actually a couple times a month, information sessions, support groups that we like the patient to stay involved because it's been really demonstrated to lead to increased success long term.
Is it tough sometimes to make that first step for people to say, I'm going to go in and speak with a medical professional and I need to get more help than I can do by myself?
It can be very tough. Patient, first of all, has to admit that their health is failing them.
Right.
And that there's something that can be done, but it also takes a lot of work. It takes that admission that you need help, and then it takes the effort to become involved.
Once they come in, they get the surgery, you still know, as you said, it's a big operation, but do the rewards really outweigh the risks?
For the vast majority of patients, they do. Of course, it's surgery, there is a risk of complications, but when you really put your mind to it, you go through all the education, the support, and then you have appropriate people around you to help you, and you're determined, it can be very, very positive.
Very positive indeed. We have the website, the phone number on screen. Somebody can look up the information and then know how to get in contact with you, the team at Riverside, that could really help them reach their ultimate goal. So thank you for being with us.
Thank you.